In 2006, Rebecca Fogg had been working on a marketing presentation well into the night in her Brooklyn apartment. She called it quits a little after 2 a.m. and started getting ready for bed. But when she went to brush her teeth, Fogg's sink only sprayed out air.
When you live in a one-bedroom apartment in New York, if your sink doesn't work, that's fine. You've got another one. If your toilet doesn't work, you've got a problem. So I immediately, with barely a thought, I reach over to flush the toilet, and that's when it all started. So my consciousness changed very much in that moment. I heard a loud noise and then I'm instantly disoriented. And the first thing I saw was this little tiny spray of blood at about eye level on my shiny yellow tiles in the bathroom.
Surely it's not actually blood, but what else could it be? Fogg's mind tries to piece the puzzle together and finally finds the answer when she looks down at her right arm to find a gaping hole where her wrist should be.
This probably took nanoseconds, but I'm staring into my wrist and I see just gushing blood and all kinds of, squiggly structures that I don't know what they are. And it actually took time. I'm looking at it. I'm saying, this is interesting. And then I'm like, oh, that's not good. We shouldn't be able to see the inside of a body. Oh, this is happening to me. This is my body.
The awareness catapults her into action. Realizing this is a life or death moment, Fogg plays out different scenarios to figure out her next steps.
I'm losing all this blood and I'm thinking I'm going to pass out, or just because it's horrible or because I'm losing too much blood. So I don't know if I have time to do everything I need to do. And I figure there are two things I've got to do. I've got to stop the bleeding and I've got to call emergency services.
But how can she stop the bleeding? A chunk of porcelain from the toilet tore through Fogg's artery and now blood is spraying everywhere. She still remembers the sound of it slapping against the floor.
And I'm like, I need to call emergency services first, because if I try to stop the bleeding and I fail, I'm slumped against that door again.
Fogg makes her way to the landline in the other room, tracking blood through her apartment. She calls 911 and moves on to the next pressing issue, stopping the bleeding.
So I run to the kitchen and I'm with the linen dish towels. And eventually I stop the bleeding with great difficulty and multiple tea towels. And then with my phone tucked between my ear and my shoulder, and it's very slippery with the blood, so it's hard to stay there, I go over across the hall and wake up the neighbors, poor neighbors, and ask them to go and wait for emergency services.
Once one neighbor comes out, the rest follow suit. They all want to help, but what's left to do? An ambulance is on its way, and Fogg holds her arm in a death grip to stop the bleeding. The police and firemen are the first to arrive. Still lying on the ground, Fogg's only able to make out the long coats of the firemen rushing into her apartment.
And I remember reaching for them. I'm holding my hand, but I take it away from the direct pressure for a second, and I reach for one of the jackets, and I'm just tugging on it. And it's just this sense of needing to be, bring me back. And I had taken my left hand and put it back on my wrist, which is over my head, and I'm clamping it so tightly. And he just has to work really hard to pry my left hand off of my wrist. And then with his giant gloved hand, he continues applying the direct pressure so that I can at least be relieved of that.
When the paramedics took Fogg to the hospital, her injury was dubbed a spaghetti wrist. The term is used when there's a deep cut that severs tendons, nerves, and arteries. The exposed tendons can look like a mess of noodles and red sauce. After undergoing surgery and physical therapy, Fogg's hand had regained enough function to return to work and accomplish important daily activities. She began writing about her experience, which is now detailed in her new book, Beautiful Trauma, An Explosion, an Obsession, and a New Lease on Life. By the time she moved to London a couple years later, Fogg had been elbow deep in research about her injury and the care she received before getting to the hospital. When a friend presented Fogg with the opportunity to speak with one of London's air ambulance emergency doctors, she jumped at the chance.
He said, "Why don't we meet on the helipad?" And I was like, yeah, I definitely want to see the helipad. And so he answered all my questions, and it was absolutely fascinating. It was so helpful. And then while we were talking, he told me that the air ambulance had just gotten a grant to write a business plan for an expansion into education, innovation, and research. And as we got talking, I was saying, tell me more. Maybe this is something I could help with.
Fogg's background in business and her intimate relationship with emergency services made her the perfect candidate. She was quickly hired and co-founded the Institute of Pre-Hospital Care at London's Air Ambulance Charity. It's partnered with the local university to offer the first undergraduate degrees in pre-hospital emergency medicine.
So the reason why the Institute was an important vision was because due to the unique methods of London's air ambulance and the very large volume of serious trauma that they see every year, they have this really unique expertise. And it's not just useful in a pre-hospital environment, it's also useful in any clinical environment.
London's air ambulance charity was formed in 1989 to serve the city's most seriously injured patients. Its teams consist of advanced trauma doctors, paramedics, and consultants. They treat an average of 5 patients each day, many of them victims of car accidents, stabbings, and shootings. Dr. Claire Park, a consultant in pre-hospital emergency medicine with London's Air Ambulance, says the goal is to give patients life-saving interventions that will get them to the hospital alive. One important aspect of this emergency care is the team's ability to provide immediate pain relief.
It enables us to get them really comfortable really quickly by giving them really strong drugs. And they have side effects, so knowing which ones to give and how much to give to get them comfortable and be able to splint broken legs or limbs and comfortably move them as quickly as possible to hospital. So that certainly we know can impact on people's psychological effects post-injury and any pain they get later on. If the pain is managed well early, they tend to get less ongoing pain later.
Teams can also replenish a patient's blood loss and improve breathing, which sets them up for better outcomes later in their recovery. If you're thinking this sounds different than emergency pre-hospital care in America, you'd be right. Park says enhanced medical teams have become normal in the UK, meaning that paramedics are accompanied in the field by specially trained doctors. It allows them to provide advanced medical interventions at the scene of the accident.
I think what we bring as a team working together with a paramedic, but we bring a skill set that allows us to deliver the next level of care of interventions that sometimes can't wait till you get to hospital. So some of the things that we do are that giving an anaesthetic by the side of the road, opening a chest. If someone has a stab wound to the heart, we will open their chest. So essentially get to their heart to release the blood clot and allow their heart to start beating to get them to hospital. Or we'll put what we call an internal tourniquet into the femoral artery and blow a balloon up in the aorta to stop any bleeding inside.
Which can only be done with a trained doctor present. However, none of this matters if the patient dies before the team gets there.
The two things that will, if we're looking at life-threatening things, the two things that will kill people in the first 5 or 10 minutes are obstructed airways and external bleeding.
Which Fogg experienced when the piece of porcelain cut through her artery. Much like in that situation, Park says there are steps you can take to make sure you're alive when the paramedics show up. While Fogg first stopped the bleeding with direct pressure from kitchen towels, Park says another option is to cut off the blood supply by making your own arterial tourniquet.
So getting something like a scarf and making a windlass, so twisting it down to just get that pressure to stop the bleeding. Those things definitely will keep someone alive until somebody else can get there.
Other than losing too much blood, Park also mentioned a second threat where the injured person's airways are obstructed.
If someone has a bad enough head injury that they're hit over the head, they can become unconscious, and opening their airway with a jaw thrust, so pushing their jaw forward to open the airway and allow them to breathe. If that is delayed and they're not breathing for a good few minutes, obviously it's too late by the time we get there. So those two simple things, and then putting someone in the recovery position to keep their airway open, are really important.
To move yourself into a recovery position, start to roll onto your stomach with one knee bent up so you're not lying flat on your front. One of your hands also comes up under your chin for support.
So imagine if you're sleeping on your front and you have your arm under your pillow to kind of keep your head up. So essentially the aim is that your airway is forward, so your throat, your tongue can't fall back and block your throat like it would on your back. So you're lying on your front, but you're not totally flat on your front. You're just in a sort of slightly three-quarter position with one knee up and one hand underneath your chin, so you can keep it up and keep your airway open.
Giving yourself the best chances of survival until first responders arrive. Fogg understood this in her own emergency, not allowing herself to fully take in her situation until she had done all she could to save herself.
If I had fallen immediately to the floor in the bathroom, shrieking in agony and terror, I wouldn't have gotten myself out of there. So in any case, I didn't feel any fear at all until the emergency services arrived. And then it was terror like I have never experienced any emotion before. I was made of terror. I've never experienced anything before or since that was that strong.
Today, Fogg's hand looks normal to anyone she passes on the street. Even her scar can be hard to spot. The strength in her right hand is almost the same as it was pre-injury, and it has great range of motion. However, Fogg's fingers are unable to move completely independent of each other, and she says it feels like her hand is constantly falling asleep. She doesn't feel much sensation throughout the area, but she can feel temperature. In fact, it's more extreme, meaning that holding a cozy warm cup of coffee in her left hand feels scalding hot when held in her right. Fogg's book, Beautiful Trauma, is available now wherever books are sold. You can find more information about Rebecca Fogg, Dr. Claire Park, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield. Coming up next week on Radio Health Journal,
the TikTok algorithm, right? It created these categories of the sort of TikTok tics, and there was some kind of modeling effect for these functional tics.
breaking down the shocking rise of functional tic diagnoses.
Then giving girls the courage to speak out about sexual abuse.
You know what? Incest is the most common sexual abuse, and it is the least discussed.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
If we had single teachers, their kids would be on free and reduced lunch because it's hard to make it as a teacher, just a single person on a teaching salary.
The ways in which we're failing the teachers who are shaping the next generation of Americans. Then,
once someone is given that opportunity, they will shine.
The climb to gain recognition as a minority in Hollywood. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.